Strongyloidiasis. Strongyloidiasis is a parasitic infection that can be caused by two species, Strongyloides fulleborni and Strongyloides stercularis. But Strongyloides stercularis is more common and represents most of the cases of strongyloidiasis. That's why this talk is going to be based mainly in Strongyloides stercularis infection, but keep in mind that these two infections are gonna manifest very similarly. So here we go. Um, where does Strongyloides stercularis infection presents mainly? Okay, this is gonna be in rural areas, and we're gonna see in a few minutes why. Here's the life cycle of Strongyloides stercularis, and we're gonna see that it all begins with a infecting filariform larva, which is gonna be found on the soil. Okay, so here's the soil, and here are some of the infecting larvae. Okay, and the infection is gonna be acquired through contact with the skin of the host. And it is important to know that it is not painful. The larva can penetrate the skin without causing any pain. It can cause some itching, but it's not painful. Okay, so when it enters in contact with the skin, it can infect the host. And how does it enter, or how does it penetrate the skin? Well, we're gonna see that it can enter the skin uh, in, as we already mentioned, is present mainly in rural areas. So in rural areas, sometimes people don't wear shoes while they walk with their barefoot like that. So as they step, they might step in a piece of soil that has some larvae which enter in contact with the skin, with the skin, sorry, and that's how the infection starts. Okay, this is why, as we will see later, the main manifestations that are seen on the skin are mainly found either on the buttocks or on the feet, because these are the sites that enter in contact with the soil that contains the larva. Okay, then after the infection has penetrated the skin, it goes to the circulatory system in the host, okay, where it travels. Okay, here goes the larva. This is a vessel, a blood vessel, and it's going to reach the alveolar sacs. That's right, the alveolar sacs found on the lungs, in the lungs, and it's going to penetrate the alveolar sacs. From there, the larva is going to ascend. Okay, and when it reaches the larynx, the host is going to swallow it so that it goes to the intestine, to the bowel, where the adult form of this parasite is going to live. And this process, the process by which the larva travels to the alveolar sacs, goes to the larynx, gets swallowed, and then reaches the intestine, is called autoinfection. Okay, this is the only parasitic infection that does this. Okay, that doesn't need of the host to do the autoinfection process. Okay, it do it on their own. And then the larva that lives within the intestine produces some eggs. These eggs develop into a rabidiform larva, which is seen here, and this larva is going to be excreted through the feces, and they are all ready to infect another host. Okay, fine. Now, What are the manifestations that can be seen with this parasitic infection? Okay, it is important to keep in mind that most infected individuals are going to be asymptomatic. Okay, uh, and some of them can develop eosinophilia, but isolated eosinophilia with no other clinical findings. Okay, and the patients that can develop the disease, or the patients that most frequently develop the disease and the clinical manifestations, are patients that are immunosuppressed. Okay, and the manifestations can be divided in dermatologic manifestations, gastrointestinal manifestations, pulmonary manifestations, and there's something called hyperinfection. Okay, so dermatologic manifestations, as we already saw, the parasite is gonna enter through the skin, and by doing that it can leave behind these lesions on the skin, and as we see, it is most oftenly found on buttocks or on the feet, as we see in this case. And we can see the pathway that the parasite followed. And something to keep in mind is that there's another parasite that can show these same dermatologic lesions, and is larva migrans. Larva migrans, that's another parasite that can be transmitted either from cats or from dogs. So it's either called Toxocara cani or Toxocara cati. Okay, and so but the difference between these two, are, or at least how they manifest on the skin, is that larva migrans has a very slow uh, advancing pathway. Okay, they advance like about 1 to 3 centimeters per day, while strongyloidiasis stercolari is going to move faster at about 5, oh sorry, that's supposed to be a 5 to 15 centimeters per hour. Okay, so that's a way to at least differentiate the dermatologic uh, lesions, but also the clinical presentation and the symptoms are different. Okay, and in these patients with strongyloidiasis, this dermatologic lesion is called larva currens. Okay, now the other manifestation that can present is gastrointestinal manifestations. Why? We already talked about it when we see the life cycle, because the site where the adult worm is gonna live is the intestines, and this can cause either constipation, diarrhea, uh, and some other gastrointestinal manifestations, but those are mainly the ones. Pulmonary infections, well, as we saw, after penetrating the skin, goes to the circulatory system, travels to the alveolar sacs, and in the alveoli, this infection can lead to a presentation of interstitial pneumonia, or acute respiratory distress syndrome. Okay, but which patients are going to be more symptomatic and present a more robust clinical findings? Well, these are going to be immunosuppressed patients, the ones that can present the symptoms, and there's something called hyperinfection, which is mainly seen in immunosuppressed patients. Okay, and what it is? It is the rapid proliferation of the life cycle of the parasite in the immunosuppressed individual, mainly because it can't fight the infection. Okay, um, so uh, in these patients, only in immunosuppressed patients that develop hyperinfection, mortality can range from 50 to 80%. Okay, this is the population that where the infection can be mortal. Okay, uh, and and there are important associations of the disease. As we said, it is more commonly seen the hyperinfection in patients that are immunosuppressed, but the most important association is with patients co-infected with human T lymphotropic virus. Okay, these patients tend to develop a more severe course of the disease, and this is mainly because these patients have decreased interleukin counts, and they also have decreased immunoglobulin E, which we know is important to fight parasitic infections. Okay, uh, patients that develop hyperinfection tend to have some complications, and some of them are sepsis with gram-negative organisms. Okay, the treatment, there are many options, but one of the most studied ones, or one of the most used ones, is ivermectin. Um, and the way it is given is about 0.2 milligrams per kilogram, and sometimes this is given once or twice. And if it's gonna be given twice, at least we should wait a week between both doses. Okay, between the first and the second dose. Um, and this has a success rate of about 97 to 99%, so it is a pretty good option treatment. Okay, uh, this is the most important features of the disease. I hope you find it helpful.